Hi, my name is Rafter Manuel and welcome to my vlog. I know some of you love to watch medical TV series, and that's maybe the reason why you became a nurse after watching this episode from The Good Doctor. Check this out. And so what happened was Dr. Sean Murphy, the young surgeon, placed a chest tube into the pleural cavity of the injured kid. And there's a medical term for that: thoracostomy. Thoracostomy is a procedure that places a tube in the space between the lungs and the chest wall or the pleural space for the purpose of removing either air, removing blood, purulent drainage, or other bodily fluid that is foreign in that space to restore the mechanical function of the lung. There are common reasons why chest tube is needed for a patient. Number one, it is because of collapsed lungs or pneumothorax. This occurs when air has built up in the area around the lungs or the pleural space from a leak in the lung. You see, failure to remove such air can be life-threatening. That is why removing the air allows the lung to re-expand and seal the leak. Another reason is infection. An infection can sometimes cause fluid to build up around the lung and may be necessary to insert a chest tube to remove the fluid. You see, getting the fluid out can at times help clear the infection faster. I will take you virtually on how this procedure is done. The first step in the placement of the chest tube is for the doctor to identify the insertion site. It is in the 5th intercostal space just anterior to the mid-axillary line on the affected side. This can be found by using the nipple level as a landmark for the 5th intercostal space. With the patient lying supine, the patient will be positioned with the hand up and over the epislateral shoulder. The patient will then be surgically prepped. Using a small gauge needle, the doctor will locally anesthetize the skin and subcutaneous tissue and the periosteum of the underlying rib and the pleura just past the rib. The doctor will then make a 2 to 3 centimeter transverse incision parallel to the line of the ribs at the predetermined site. The doctor will dissect over the top of the underlying rib until the next highest intercostal space is encountered. With the tip of the hemostat, the doctor punctures the parietal pleura, as what you are seeing right now, while pushing just at the top order of the rib to avoid damaging the neurovascular bundle that lies along the groove at the inferior border of each rib, and then withdrawn while it is still open to create a sufficient opening for the chest tube. Just before inserting the chest tube, a finger is inserted into the hole of the pleura and moves around about 360 degrees to confirm correct location in the pleural space by feeling the lung and making sure that there are no adhesions or obstructions to placing the chest tube. Before the insertion of the tube, the proximal and distal ends of the tube are clamped. The chest tube is then advanced into the pleural space to the desired length. The chest tube should be positioned posteriorly and aims superiorly into the chest cavity. This will allow for maximum drainage in the supine position. Finally, the chest tube will be connected to an underwater seal apparatus collection chamber. Thank you for watching, guys. Once again, this is Rafter Manuel, BSN4 Patricia Benner.